That is an appendix that was removed during emergency surgery. Kind of wild, right? So let's talk about what your appendix is, why it gets inflamed, and how to recognize the warning signs of appendicitis. Your appendix is a small pouch about the size of your pinky, hanging out your large intestine on the right lower side. Doctors used to think that they were useless, but we now understand that it helps your immune system. However, you can live perfectly fine without it. So what is appendicitis? Think plumbing problem. The appendix gets blocked, usually by stool in the large intestine, or inflammation, or a stone in the appendix called an appendicolith, and bacteria multiplies pretty fast. It swells up, fills with pus, and if ignored, the appendix can burst, spilling infection into the belly and the pelvis area. Now that becomes a medical emergency. So how do you know if it's appendicitis? The pain usually starts in your belly button and then moves to your right lower side and gets sharper. Movement, walking, coughing, laughing makes it worse. You may also have nausea, loss of appetite, and low fever. The pain keeps getting worse and not better. That's important because appendicitis can be confused with gas pain, which moves around the belly and fades over time. Appendicitis pain zeroes in that right lower abdomen side, and the pain intensifies over time. Early appendicitis can be treated with antibiotics and or surgery. Surgery is more common though. But when it bursts, the treatment becomes a little bit more complicated, and it's usually in stages. The bottom line is that if you've got worsening belly pain on the right side of your belly that just won't quit, trust your gut literally and follow this channel for awesome medical education and tips like this.